Welcome back to Ellie Scrubs In. In this guide, we explain the most commonly used absorbable and non-absorbable suture materials, why they behave the way they do, and how to match them to real tissues and scenarios. We will also point out common pitfalls and when to avoid a given material. Let's get started. Quick framework. Make 2 decisions for every closure. First, choose absorbable versus non-absorbable based on how long the tissue needs tensile support relative to its biologic healing curve. Second, choose monofilament versus braided. Monofilament has a single smooth strand with lower capillary action and lower bacterial harboring, but more memory and sometimes trickier knot security. Braided consists of multiple filaments woven together, which improves handling and knot holding, but can wick fluid and bacteria and increases surface drag. Then, match diameter and needle to tissue thickness and access. Absorbable sutures. Polyglactin 910, brand name Vicryl. Vicryl is a synthetic braided copolymer that ties crisply and holds knots with little effort. It keeps useful strength for roughly 2 to 3 weeks and is generally absorbed by 2 to 3 months. Think of it as a dependable workhorse for clean, soft tissue layers. Reach for Vicryl in subcutaneous fat, mucosa, intradermal deep bites beneath a cosmetic skin run, bowel seromuscular imbrication in clean fields, gynecologic pedicles, and general ligatures. Avoid Vicryl where contamination is present or likely, traumatic lacerations packed with soil, open fractures, bite wounds, and chronic sinus tracts, because braid can wick microorganisms. Also, avoid it for long tension closures such as midline fascia. Its strength falls off too early for that task. Polyglecaprone 25, trade name Monocryl. Monocryl is a smooth, synthetic monofilament that glides with minimal tissue drag and has a very low inflammatory profile. It loses most tensile strength within 1 to 2 weeks and is absorbed over 3 to 4 months. It is well suited for cosmetic subcuticular skin closure, buried dermal stitches under low tension, pediatric facial lacerations where removal is difficult, and intraoral mucosa when a monofilament is preferred. It should be avoided for structures that need prolonged support, linea alba, fascial defects, tendon repairs, and high-tension extremity closures. Expect more memory than a braid. Deliberate, flat throws and an extra knot improve security. Polydioxanone, brand name PDS. PDS is a synthetic monofilament suture that provides prolonged absorbable support. It retains meaningful strength for several weeks and fully absorbs in about 6 months. It is preferred for midline fascial closure, ventral hernia repairs when permanent material is not desired, ureter or bowel anastomoses that need longer support, and pediatric closures where growth and long-term reactivity matter. It is less suitable when early relaxation is desired to prevent track marks in thin skin, and where knot stacks would be prominent under thin dermis, because the material is springy and knots are bulkier. Pearl. Slow, flat, symmetrical knots with conscious locking limit knot creep. Rush technique is the common reason for slippage with PDS. When using PDS with tissue under tension, such as fascia, a minimum of 6 knots is required. Gut sutures. Plain, chromic, and fast-absorbing. Catgut, historically derived from the submucosa of sheep or goat intestines that were cleaned, twisted, and polished, hence the name gut. Modern medical gut is purified collagen from similar sources. It is digested enzymatically rather than hydrolyzed, so absorption varies with local inflammation and infection. Plain gut offers roughly 7 to 10 days of strength. Chromic gut is tanned with chromium salts to slow digestion, providing modestly longer support. Fast-absorbing gut is processed for very short epidermal support in low-tension skin. Appropriate uses include oral mucosa, selected pediatric facial lacerations when removal is impractical, and temporary skin stitches on very low-tension areas. It should be avoided in contaminated wounds, in immunocompromised tissue with unpredictable inflammation, and wherever predictable or prolonged strength is necessary, such as fascia. Barbed absorbables. Stratafix or V-lock. Barbed monofilament sutures anchor along their course, distributing tension and eliminating knots. They are valuable for long subcuticular runs, laparoscopic layer closures, capsular and peritoneal reapproximation, and cosmetic cases where a knot stack would be visible. They should be avoided in friable tissue, in small fields where precise tension adjustments are required after placement, and enclosures that may need later revision because reversing a barbed line is difficult. Purl. Even bite spacing and depth are essential. Barbed sutures reward steady cadence. Irregular bites create uneven tension that cannot be corrected with a final knot. Non-absorbable sutures. Polypropylene, brand name Prolene. Prolene is a synthetic monofilament suture that is highly inert, slick, and permanent. It is a default choice for vascular anastomoses, eversion skin stitches that will be removed, mesh fixation in clean cases, and selected tendon sheath or percutaneous retention sutures where minimal tissue reaction is desired. It is poorly suited to buried subcuticular work because knots are bulky and palpable, and it is problematic when teams struggle with knot security. Memory and slipperiness demand extra throws and careful tensioning. Purl. For skin, a horizontal mattress with Prolene provides excellent eversion with easy removal, but removal timing must be set to avoid track marks. Nylon, brand name Ethilon, for monofilament. Nurolon for braided. Monofilament nylon is a staple for removable skin closure in the emergency department and clinic. It is inexpensive, easy to remove, and reasonably inert. It also appears in microsurgery at very fine diameters. Nylon should not be buried for permanent internal use because it will persist. When a buried dermal stitch is required, an absorbable alternative is preferred. Braided nylon exists for deeper soft tissue uses, but carries the usual braid cautions in contaminated fields. Purl. When monofilament memory causes knot lift, moistening the line, laying throws deliberately flat, and avoiding tissue torque correct most issues. Silk suture. Silk handles exceptionally well and has superb knot security, which explains its continued presence in many surgical trays. However, it is more reactive and, as a braid, can harbor bacteria. Suitable uses include ligatures in clean elective cases, securing temporary drains or chest tubes when reliable knots are essential, and teaching environments to demonstrate fundamental knot mechanics. It should be avoided in contaminated or infected fields, on skin where track marks and reactivity matter, and within urinary or biliary tracts where it can serve as a nidus for stone formation. Polyester, brand name Ethibond. Polyester is strong, durable, and favored for tendon and ligament repairs, cardiac valve work, and some abdominal wall reconstructions. It is braided and coated to reduce drag compared with uncoated braid, but wicking is not completely eliminated. Polyester is indicated when non-absorbable strength with reliable knot security is required, and the field is clean. It should be avoided in dirty or trauma wounds, and in settings where a monofilament can achieve the same goal with less infection risk. Purl. In tendon repairs, pairing polyester with load-sharing stitch patterns such as Krakow, Bunnell, or locking loops distributes force and prevents cut-through. PTFE, also known as Gore-Tex. PTFE is an ultra-inert monofilament suture with a smooth, soft hand. It is used in cardiovascular and valvular repairs, septal work, and delicate soft tissue reconstructions, where minimal reactivity and long-term stability are essential. Because it is slick, knots must be laid with precision and adequate throws. It is also more expensive and not universally stocked. PTFE is not ideal when high friction is required to lock tiny knots quickly or when cost or availability is limiting. Purl. Gentle, even tensioning prevents sawing. The material's softness should be allowed to work rather than forced. Stainless steel. Steel provides maximal strength and excellent biocompatibility and comes as a monofilament or a multifilament wire. It is the classic choice for sternal closure and is used in selected orthopedic and abdominal wall reconstructions. It resists creep but is unforgiving. It can kink, sharp ends can pierce gloves, and it can cut tissue if mishandled. Steel is poorly suited to small, delicate soft tissue fields, where a softer material will suffice, and enclosures where hardware-related discomfort is a concern. Purl. Wire ends should be bent and buried flush. Exposed barbs are a common source of postoperative discomfort. Practical suture matching recap. For removable skin, use nylon or polypropylene monofilament and remove on schedule to avoid track marks. For cosmetic subcuticular skin, use Monocryl or an appropriate barbed absorbable when tension is low and external removal is undesirable. For fascia and linea alba, use PDS for longer duration support with deliberate knot security. For contaminated wounds, favor monofilament materials and avoid braids such as Vicryl or silk when possible. For vascular anastomosis, use fine polypropylene for inertness and smooth passage. For tendon and ligament, select strong non-absorbables such as coated polyester, paired with load-sharing stitch patterns. For friable viscera, combine a low-reactivity monofilament with a taper needle and match duration to the expected healing timeline. Choose absorption based on the tissue's healing timeline, filament structure based on infection risk versus handling, and size and needle based on access and control. When uncertainty exists, a reliable default set is Monocryl for subcuticular skin, PDS for fascia, polypropylene for vascular and removable skin, and Vicryl for clean soft tissue beneath the skin. Read the packet, read the tissue, and allow these rules to guide selection. Thank you for watching Ellie Scrubs In. Please like the video and subscribe so viewers do not miss upcoming surgical skills guides and instrument walkthroughs.